So we're discussing sciatic nerve flossing, and so nerve flossing or gliding as well as tensioning is a part and is actually foundational of any sciatica rehab or treatment. This is absolutely key, especially if you've had sciatica or nerve pain down your leg for greater than 4 months. Nerves need three things: space, movement, and blood flow, and you improve all of those when you do some sort of sciatic nerve flossing or gliding or sliding, whatever you want to call it. I know you've probably done something like this before, but I can promise you this is a different way of doing it, and this is what actually helped me with my sciatica. It is very easy, it's very useful, but the dosage, how much you do it and how it should feel, and the position is very, very key. So I'm gonna go over that right now with you. So I do recommend that you use a wall in your house. I'm gonna use this to mimic a wall. Let's pretend that it's my right leg that I'm having sciatica in. I'm going to brace my right leg up the wall and my left leg is going to be straight. So I'm gonna go up the wall here, and my left leg is gonna be straight. I'm telling you, it's okay if you don't have as much flexibility as me and you have to be further away from the wall. That's absolutely fine. You're gonna start with your heel on the wall and the knee slightly bent, the left leg straight. You're just gonna hang out here for a second. You shouldn't have any symptoms. Now I'm gonna ask you to do is try to straighten your knee as much as you can until you have symptoms. Let's say right here is where I have symptoms. Symptoms can either be in your glutes, your hamstring, or down in your calf and your foot. Now you're gonna stop here when you have symptoms. You're gonna point your toes down and those symptoms should go away. And you should pull your toes up towards your face, and you should have an intense amount of symptoms in your calf, tingling in your foot or toes, etc. Now, when I relax my foot and point it down, those symptoms should go away. What makes this easy is that you're able to lie here and have no issues at all, or not have to use your arms to hold your leg up or use a strap. You can be completely relaxed because we're gonna hang out here for a while. You're going to get into the position where you have symptoms, straighten your leg, pull your toes back. First round of this is going to be pull your toes back and point up towards the ceiling. Toes back towards the ceiling. This is really great if you're having like moderate to intense symptoms. So you're sliding the nerve up and down, up and down. I'm trying to keep my legs straight, but I'm pointing my toes towards the ceiling and I'm pulling toes back. So that heel is kind of moving on the wall. And you should do this 20 or 30 times. This is a great way to slide that sciatic nerve. It is completely normal to notice that you're having tingling in your foot and calf like I am now. Everything is tingling because of that nerve is moving and I'm using it. So if I start to have tingling, I just relax my foot and I just wait for that tingling to go away. So if you're in the beginning stages of sciatica, I recommend doing this sliding, couple sets of 30, pointing your toes up and down once or twice a day, doing that for a couple weeks. Now, as you've moved past that, you've had sciatica for a long period of time or symptoms are a little less severe, I will recommend that you try to get the legs straight. You're gonna pull those toes back and you're gonna hold this position for 30 seconds to a minute. And you can feel anything from glute, hamstring, calf, or foot tingling or burning or like a more intense amount of symptoms. Everything is within normal limits there. Because I am tensioning that nerve, and what's that's doing is it's forcing the nerve sensitivity to go down. We're telling it to become more tolerant of movement, because if you were to flip me up, I would be trying to bend over and pick something up. If you were to put my foot here on the ground, it would kind of represent the same position of bending over and picking something up. And so it's very functional. It's been about 30 seconds now. I'm going to relax that stretch and let symptoms calm down. So in between reps, you're going to let things completely calm down. And I still have some tingling in my foot or in my calf. That's starting to go away now. I'm going to get back into that position and I'm going to pull the toes back and hold it. Now the progression for this is doing 3, 4, maybe even 10 reps of that 30-second hold. And what you could do is get your butt closer to the wall, scooch, scooch, get that butt closer to the wall. You're gonna get more intense symptoms. So at the same time, you're improving your hamstring length, but you're also improving the sensitivity of the nerve. This is a game changer. This has helped so many of my patients improve the neural sensitivity, especially in those who've had sciatica greater than 4 months, and they just have lingering pain. And so you have two variations there. You have the gliding, which is the foot going up and down, and then you have the tensioning, which is pulling that foot back, maintaining that stretch for 30 seconds to a minute, and telling that nerve to calm down in its sensitivity. So those are my absolute favorite nerve glides or nerve tensioners to give the patients when they're suffering from sciatica for greater than 3 or 4 months or so. So try those out. Let me know how you feel. It is normal to have some tingling after, but even now I am completely symptom-free and I just feel loosened up. Doing those once or twice a day over a couple weeks should notice improvement in your ability to bend over and just having symptoms down your leg. Let me know what you guys think. Leave a comment underneath the description, and I appreciate you guys watching the video. Like and subscribe if you like the content.